Well, welcome to another episode of our series. We simply meet up every week on Thursdays at 6 p.m. to discuss systemic barriers facing Black professionals. And this week we have healthcare professionals. If the other two join us sometime in between the call, please excuse me. But I think there may have been some type of miscommunication. But for now, we're just going to proceed on with who we have on the panel. So let's start off with the introductions. Again, we run this every Thursday. This is mainly to discuss systemic barriers facing Black professionals in different industries. And this week we have healthcare professionals or Black professionals in healthcare. And I'd want to start off first of all with introductions. And on my left-hand side would be Policia. So I'll let you go first.
Yeah, no problem. Hi, everyone. My name is Policia DeGans. I am a policy analyst at the Canadian Cancer Society, which basically means that I lead policy, advocacy, some health education activities, looking to improve cancer outcomes. And one of the projects I am leading is an innovative project to improve prostate cancer outcomes, specifically in the Black community, since we are at higher risk of prostate cancer. I have worked at various health organizations. I have worked in the Ministry of Health, the Ontario Public Service. I've been at the CAMH. I've been at the Durham Regional Health Department, University of Ottawa Health Services. So I have worked in various different capacities in different organizations in healthcare. And I also am a board director at the Davenport Perth Community Health Centre.
Very good. Thanks for the introduction there. That's a great length of experience. That'll be great on this panel. And Charles, yourself?
The work that I do. So health, which is community-based research. It's called the We Speak on Black Men's Health, trying to understand the what makes Black men healthy or sick. But also we have a sexual health component, specifically in HIV prevention. How can we prevent HIV within the Black community, and particularly Black men? And I am currently also with the Cherno Community Housing Corporation, so TCSC, where I'm with the Confronting Anti-Black Racism Unit, and we're trying to develop an anti-Black racism strategy for TCHC. And outside of that, I'll say my experiences overall are at an intersection or encompasses public health, public sector, working with marginalized communities like Black communities to see what ways that we can really uplift our health.
Very good. Thanks for the introductions there. That was great. And for myself, I'm Kevin, and I am a management consultant, and I consult in the space of D&I or EDI, or however you want to call it. I mainly go by just inclusive participation or inclusive leadership. And with this, by that I mean I simply consult with my clients and work with my clients and partners to create room for inclusive participation in their workspaces, and with a target on specifically anti-Black racism, racial learning, and understanding and creating awareness. And from a community perspective, I normally run these forums, and we talk about different topics, different issues, and try and just, see the cross section of how we can leverage our lived experiences and try and combat systemic racism. And so without further ado, let me just jump into some of the questions that I sent out. So consider the journey. Obviously, joining healthcare as a healthcare professional is not one that would be considered an easy journey, whether it's a physician or any other practice. So what are some of the challenges that you have faced in your journey as a Black professionals, or rather in interacting in healthcare in your case? And I guess we'll start off with Policia and then we'll go all the way around again.
So I think one of the biggest challenges that I have come across in terms of my experiences working in the health sector is often being the only Black person in the room, and actually typically the only Black person in the division, and if not the organization. And so with that comes a lot of having to figure out, how do I navigate this institution knowing that no one looks like me, knowing that no one in leadership looks like me. So how do I navigate thinking about my career path going forward? And then also thinking about, how do I navigate my progression? Sometimes I'll change my hair and then I have to deal with coworkers who decide to touch my hair or ask a lot of questions. And those kind of things are difficult to navigate when you are the only Black person in the organization. And then to compound that, sometimes you bring up issues that impact your community. And when you are the only person who's a member of that community who's able to speak up about issues impacting your community, it sometimes falls on deaf ears. So I find that's the most challenging thing is working in healthcare, in my experience, often being alone.
Very good. And curious to know, so is there something that's, or maybe that'll probably jump into the next question. So how do you normally deal with this? So I'll give you an example. You mentioned that, someone touching your hair or being the only person in the room that's a Black professional. How do you deal with it? How have you dealt with it?
So the way that I mitigate that is I will reach out to folks in my own personal circle. So outside of my organization, whether they work in the health sector or the policy sector or not, and get second opinions on how to navigate these situations. And so despite being alone in the certain setting of the organization or of that room for a meeting, it helps to get some second opinions and think about how to navigate the situation going forward and think about how to address issues that have come up.
Very good. That's very interesting. Actually, it's simply how most people just deal with it is trying to find someone to first of all validate your experience and then finding a way to navigate through those experiences. It's very interesting. So, how about yourself, Charles? What's your journey been like?
Yeah, I guess I'll start from the journey phase, the starting out phase. For me, it's really been having access to a network of individuals who can help position you in places. So I came here some 10 years ago with my family as an immigrant, and was able to get into school. Did my undergrad at U of T, did my master's at Carleton University, and what I started to realize, and not just me, but with other colleagues of mine, especially those who were Black, were they seemed to be working a little harder when it came to finding opportunities, applying for opportunities, knowing folks, and just being able to get our food into the door. So for me, uh, initially I thought that this was just very specific to my experience, but the more you talk with folks, the more you share your stories, the more you realize, hey, wait a minute, there's something happening here. So for me, that's been the main challenge, having an access to a network of individuals who can not just position you places, but also speak to your competencies, speak to your skills, share information with you. So a lot of times we think that the way jobs are gotten or the way people's career progress is through the hard and fast way of what do you call that, meritocracy. and I think a lot of times when you go through school, especially when you come here as an immigrant, and I remember even in high school, my mom saying, "Oh yeah, just study, you're gonna make it," which I did, and I'm glad to say that I made it to a degree. A lot of times, things, job opportunities, or don't often go through those formalized networks or what's been advertised outside. There's a whole nother level of informal networks and socializing, and even just conversations that you hear about things through. And so, so for me, when I didn't have access to that, then uh, I just wasn't able to progress to the extent that I felt my other colleagues, especially my white colleagues and non-Black colleagues, were able to progress. And yeah, that's been the main thing for me, the access to those networks. And finally, even getting to the healthcare field and working as a healthcare professional, I'll say another challenge is just finding mentors. So people who, especially those who can connect with you, not just on the professional level as a healthcare professional, or you maybe have a couple of, you went to the same school as an alumni, or people who have the same lived experiences and who can really understand where you're coming from. Because for me, that really allows them to feel really more invested in you, and in your case, and helping you grow.
It's very interesting. Curious to know, how were you able to validate that this was beyond, or rather, how were you able to validate that this had to do with your skin color as opposed to other scenarios? In this case, can you perhaps think of a moment where you felt like other opportunities were extended to your white colleagues as opposed to yourself, or rather, um, the systems in place favored them over your skills? Like, how were you able to validate that?
How did I know? Well, through conversations with other Black health professionals or healthcare professionals, and initially I would think that maybe it's a problem with uh, my skills not really matching a certain level, or me not really working hard enough. But through conversations, and also being in the spaces where I'm not just the only Black person, but there are other Black folks as well as other white folks there, uh, and hearing their stories, and just asking, so how did you get here, or how did you hear about this opportunity, and just hearing the stories that they tell, that, oh, I knew somebody who knew somebody and who was able to bring me here, or my parent knew somebody who knew someone in this organization. And so for me, I began to put it all together and realize that, as much as, you know, obviously I still needed to work hard and do good at school and do good at my work. Um, I think of it as a journey between two places, point A and point B. There's the there's the linear path, so just one straight path to get in there. But then there's the other way we can involve taking alternative routes, and that's more zigzag. It's possible that myself as a Black person and a white person and a non-Black person will get to the same destination, but it's the means and the journey and how smooth it is for us getting there that makes the difference. So when you know somebody who knows someone already, it just makes it easier for you to get to your destination quicker. So it's like taking the highway versus taking a side street. You will end at the same destination if things work out right. It's just the how easy and how accessible it is.
Absolutely. You nail on some really good points, especially when it comes to accessibility and access to a network. And those are things that people take lightly and don't realize that for you to succeed in any career or any profession, you're relying on those people who've been in it for many years, to navigate through that system. And one of the challenges that Black people face automatically is obviously a lack of representation in any network. So if you go into an organization and you feel disenfranchised by a lack of representation, you can only imagine. I mean, you cannot see yourself if you're not represented to begin with. So the obstacles to your journey, as opposed to, and to your point again, a linear path versus yourself and your situation having to navigate uh, uh, a crisscrossing of of your means to get to your destination. So let me ask the second question here. So I mean, based on your experience, what are the top three barriers facing, or rather, that are unique to Black professionals in healthcare? And perhaps I'll take this back to Policia, and maybe you can speak through your journey and your interactions with other colleagues that are in the profession.
Yeah, for sure. Before I jump into the next question, though, I do want to piggyback off of something that Charles said that like really resonated with me in terms of the traditional pathways that are shared with Black folks and how we can advance your careers. And so traditionally, we are told go to school, get 2 degrees, and you will get the job. And we're hearing from what Charles said that that's not necessarily always going to lead to the outcome, and often it is connections. And it's really interesting because there is research to support that Black folks are overqualified for the roles. There's research specifically in the States that Black women specifically are the most qualified for roles and are not being paid for that same type of work. So there's even data out there to support the fact that we're putting in the work, we are qualified, and yet we still are not having the same advancement as folks who are not Black. But in terms of the question about what are top 3 barriers that are unique to Black professionals in healthcare, one thing I found really interesting in terms of me and my career trajectory, I work in the public health policy space, and healthcare is a sector that overall is quite a progressive sector. Folks tend to be liberal, left-leaning. We talk a lot about social determinants of health and upstream approaches to addressing health inequities, but it's interesting that once you actually enter the systems and you're working within these institutions, that that doesn't always end up actually being top of mind and top of conversation, especially as us being folks who are Black, we do want to advocate for underserved, marginalized communities since we are a part of these communities. And in healthcare, you would think it'd be an easy space to navigate, but there actually is a lot of institutional and systemic barriers, which is difficult to understand, since it's supposed to be a space where we're supposed to be enabling that kind of progressive conversations. Secondarily, I find that in my experience working in the health sector that if there are other Black folks working in the health sector, most of the time they are kind of relegated to junior roles, and they often aren't getting the same type of advancement as non-Black folks. And so as us, we wonder, how do I advance my career when I'm not seeing other folks represented in higher positions across the board? So that also I find is another barrier, the barrier to advancement for Black folks. And then thirdly, in terms of a barrier to Black folks in healthcare is the way that we find that lived experience is not valued in the same way as like qualifications, university degrees. And so we have lived our entire lives being Black, and we have experiences navigating within the healthcare system. Anyone who lives and resides in Ontario has an OHIP card and therefore has interacted with the healthcare system. And so we're able to bring our own personal experiences to the table. And sometimes those personal experiences aren't valued in the same way as if we were to publish a research paper about it. And so I find that is difficult to navigate with in terms of being able to leverage your lived experiences and saying that this lived experience is valid and I don't need to necessarily conduct an entire literature review environmental scan, but I know anecdotally that folks in my community are experiencing these things, and I can tell you multiple people who are experiencing these things, but folks sometimes would like to relegate to the more academic literature, which is within an institution itself, which has a whole other myriad of things to consider.
Thanks for sharing that. That's very interesting. You bring up some good points, especially when it comes to people not valuing your lived experience or as a something that's worth even pursuing or unpacking. So I'm curious to know, do you believe that the reason why people may not necessarily value your lived experience, especially navigating through the healthcare space or interacting within healthcare, or the is probably a cause of maybe perhaps a lack of awareness, or rather, is it just because they just can't resonate with it because they're not Black?
I think it's a little bit of the latter, where there's maybe a lack of resonation, but I find that in the healthcare sector and science overall, there is still a very positivist thinking paradigm of we like to listen to research, and particularly quantitative research. And so over the years, we're finding there's more understanding of qualitative research and lived experiences in terms of informing program development and research overall, but there still is that ingrained mindset that we need the data, we need the stats to support this. And I think that's part of the reason why lived experience isn't held as highly like a basis to kind of do some work.
Got it. I mean, I think it's funny because you just we were talking about this morning, and I was talking to a colleague of mine, that's a consultant in the same space, and we were talking about how, for the most part, as a consultant, you're putting a business case together for someone at some point. And in the corporate world, people are so quick to ask you for, okay, what's in it for me, and where's the business case? Mm-hmm. And in that interaction, we almost, on an inherent basis, we almost always forget that there's a human element, and someone doesn't even really need to tell that they're in pain when they're screaming. Did you see what I'm saying? And we seem to remove the human element out of any quantitative analysis and or qualitative analysis to begin with. And for the most part, I think we're sometimes so research driven, and we assume that there's got to be a cause, and we gotta scientifically dissect it or unpack it and understand it. But it's so funny that people actually dismiss it, that your lived experience is something that we can't just quite discuss. Okay, show me the data. Okay, speak to it. Let me hear it. um Curious to know, do you believe, and this is just holistically, do you believe there's a huge barrier now to begin with, especially within healthcare, as a healthcare professional, especially now when you start thinking about physicians and so forth, or whatever the case is within healthcare, that there is a gap because of obviously and access to wealth?
There's a gap in terms of advancement of career because
No,
of access to wealth, what you're asking?
no, as a way of getting into healthcare. So think about
Okay.
how much you would have to spend to go through med school if you're
Mhm.
pursuing a degree in, or rather, if you really wanted to become a physician or a neurologist, whatever the case is. Think about the inequities when it comes to access to wealth. Do you
Yeah.
believe that is a huge gap? Because I think that's a huge barrier when it comes to healthcare professionals, especially that are unique to Blacks.
Yeah, I definitely can attest to that. I did my undergraduate degree at the University of Ottawa in health sciences, and then I have my master's in public health at the University of Toronto. And the University of Toronto is known to be like kind of like top school of Canada. And because of that, you pay higher tuition fees. And I do know folks who also were Black who got into the school. And they looked around and they said, hey, what scholarships are available to me? And the school said very little, and they were not able to attend, which is so unfortunate that folks who are capable and could do great work and would be able to leverage the connections that you get from the University of Toronto were not actually able to fulfill that. And so I definitely have seen that in my own personal and my educational experience.
I just want to add to that if that's okay.
Yeah, go ahead.
Yeah, yes, very similar to mine. I did undergrad at U of T, and when I applied for grad school, I actually got accepted into Queen's University in Kingston, and I got accepted to Carleton as well. And I ended up going with Carleton, and people asking, "Oh, so why did you go there? You know, Queen's is so known for their MPH, so Masters in Public Health program." And I say, "Oh, Carleton just gave me the money," and it's such a, uh, you know, a lot of folks overlook that because I'm very much aware that it is a privilege to be attending, first of all, post-secondary education, and even after that, post grad, so doing a master's. But it ain't cheap, it ain't free, and not everyone is okay with applying for government grants. And of course, you can go to school and work at the same time, which a lot of folks do. I do as well. But just imagine the financial relief and just the peace of mind that you would have from having that extra buffer from a grant that the school give to you, and just not having to worry about also kind of other scholarship. So I certainly relate to that, and it is a real decision that a lot of folks make, a lot of Black folks make, and so having to, you know, uh, not go, in my case, not go to a similarly prestigious, historically prestigious university when it comes to public health education, versus another one that's still, that's still finding its way, just only because they gave me a financial hand.
Absolutely. I believe in that. I mean, when I'm talking about access to just industries in general, I'm simply referring to not necessarily the opportunities within the school system that allow Blacks and others to pursue to pursue a certain profession, but I'm thinking about the opportunities here, where when you compare with your white colleagues, who may not necessarily have to take up a loan or a grant. Think about the opportunities there, because you gotta, these are not things that are for free. At some point you're gonna have to pay off that loan, and those are opportunities that are taken away from you to some extent. So to give you an example that I went through, I had a student loan, and took me a very long time to pay it off after I completed my studies. And when you start considering the opportunities that you could have had without a student loan. I mean, I know better now, and my kids would never know what a student loan is. But and I'm not here to either really blame what was set up for me, because your parents can only afford what they can afford at their time, and given the information that they had, right? But what I'm saying is that generally, as a population, I'm talking about blacks in general, there's obviously the inequity when it comes to wealth. And so, and as far as that goes, think about someone that may not necessarily have a privilege like you and I, that is thinking about pursuing a higher education, but they're seeing it as a long shot. When you present to someone, okay, you're going to need $80,000 to pursue this degree. So some people cannot even fathom that in their mind, because they're thinking about, okay, do I take that, and what are the other opportunities I can pursue that are probably half the price that I can afford? Because affordability is everything, and that really allows you to navigate through the system. Whereas you go through a white colleague, and I know so many people that I went to school with, white colleagues, that never knew what a student loan was, right? And they had these systems set up for them where they're going to school, everything's paid for, and so understand the opportunities that you're actually competing with once you're out of school. Someone doesn't have to worry about a student loan, or someone doesn't have to worry about, even when you're in school, you don't have to worry about you applying for a grant to minimize that student loan and so forth. So
Doesn't even
that
cross your
plays
mind.
into, yeah, go ahead. That
I said,
plays you pursuing that and making that decision to actually stay in a certain program, right?
yeah, yeah. I was gonna say it doesn't even cross the person's mind, and uh, the for the financial case, I don't know to what extent this example would fit that, but I know that the University of Toronto, they got a challenge a couple of years ago by one of their some faculty members and some black student, some black medical students about the lack of diversity in their program, and for me, there's obviously there's so many things happening at the same time. It's never just one thing. It could be even just having seen representation. So, let me just ask you, when you think of a doctor, who do you think of?
Yep.
Usually a white man who's wearing some lab coat, typically, even that imagery. And then for those students who've had the opportunity, or those kids or teenagers had the opportunity to go through that and still want to go to medical school, um, it's not unrealistic to think that when they see or when their parents, right, because it's really the parents at that point, see the cost of medical school and how long it's going to take you to start working and the amount of loans, because I think doctors end up with some like $100,000 student debt. When your parents see that, and then having to think of the opportunity costs, is like, I mean, do you really want to go there? What's going to take you? You're going to have to spend 8 years of your life here. What are the other opportunities that you can take? And even the applying to schools, remember there's an application that you got to do, and the fee is attached to that. And usually it'll be around, I say 3 to 4 or 3 to 5 medical schools that applicants will generally apply to. Even just that is it's a decision that students would have to make, and yeah, and the ability to even think about that, weigh those pros and cons. It's for those who are not able to do that, or who doesn't cross their mind. It is a privilege right there.
Yeah. Yeah. Those are some serious barriers, and which leads us to actually the third question. And this causes a lack of representation. So you walk into, the industry. And think about healthcare, and the way you walk into an office, and you always see, or rather feel like you're the only Black person in a room. Understand how access to wealth, which determines largely the representation within a certain population, within a certain industry, right? You can only imagine if there are more tools to avail, access to, pursuing these degrees or whatever the case is, especially that are targeted towards a Black community or other marginalized community. You can only imagine the difference it makes when it comes to representation, and obviously understanding, healthcare amongst Blacks, right?
Mhm.
So let me ask the third question here. I mean, what are your thoughts on the roles that the following play when it comes to confronting systemic barriers facing Black professionals in healthcare? And then we're going to start with, or rather, just you can unpack both of them. So education institutions, and government. And I'll take this back to Felicia.
Um, so when it comes to educational institutions and government and healthcare, I think it's important to think about like what aspects of healthcare is a very broad term. So there's a prevention side of healthcare, which is kind of the area that Charles and I work in, which is like public health. There's been a lot of talk about public health. We think about the COVID-19 pandemic and understanding of what that means. And there's also healthcare in terms of the treatment side. So that's within hospitals, community health centers, and that kind of thing. And so I think the approaches may actually be different depending on the setting in terms of who should be involved. And so when it comes to public health, these are things that are like government funded directly by the municipalities, and then hospitals kind of get their money through funding through the Ministry of Health. And so when it comes to like who should be dealing with systemic barriers, I personally believe it should be institutions themselves. So Toronto Public Health should be dealing with that within Toronto Public Health. Mount Sinai should be dealing with that within Mount Sinai. As much as government is should be also be involved, and so we have that with the Anti-Racism Directorate. I think it also is a dual responsibility of both the governments being involved, the institutions themselves being involved, and then when you think about educational institutions, they kind of develop the research to substantiate any changes that are proposed. But even educational institutions should be looking at themselves and thinking about how can they be addressing systemic barriers.
Those are some great points. So when I'm thinking about a disruption in the healthcare industry as a whole, perhaps consider that I mean, healthcare is so research driven to begin with, right? And there's a lot of benchmarking done within the healthcare business. So what you may find at Mount Sinai will be very similar to another setting. And so, and then that's the reason why I sneaked in government, because obviously government funds public health and so forth and so forth. So it's a large, complex, intertwined system where I believe one system can benefit the other. If there's one disruptor, there's a very good chance there's going to be a ripple effect. I mean, do you believe that this requires maybe a real holistic approach when it comes to addressing systemic barriers? Because remember, like if you're looking at systemic barriers, especially within healthcare, there's so many angles and so many perspectives. Whether it's access to get into that industry, representation, whatever the case is, funding, you name it. What do you think would be your best approach, having worked within that industry?
I believe multifaceted. The policy approach, meaning that it's upstream, it's mandated. There are both legislation and regulations mandating that, and so with that, both there being a government effort and then also mandating there be efforts by each institution. I think with having it being mandated requires therefore accountability, report back, and therefore forces each institution to develop benchmarks, see what their progress is. And then there also would then be penalties and or rewards if they are or not meeting certain benchmarks.
Do you believe this would be effective with a lack of representation? Because you remember, for it to resonate, there's got to be some type of first of all, something that people can resonate. People need to resonate with what you're doing and have an understanding and awareness. And we don't want to be in a situation where people are invalidating your experience. So how do we increase representation within healthcare for at least to have those amplifying voices? Because I mean, if you were not in healthcare, no one would be speaking to it. Did you see what I'm saying? Or
Yeah.
rather, if Charles is not doing what he's doing, then there'll be no one like him in a room. And so, I mean, we need people like you to amplify those voices. So how do we get to increase the representation to begin with? Because I can certainly understand, I mean, when you walk within any healthcare setting, you're largely underrepresented, right?
Mhm. Yeah. In terms of increasing representation, I think that it shouldn't fall on the Black community to try and get more representation of us in these places. Like we're trying, there's barriers. We've talked about the financial aspect. We've talked about access to networks. And then there's also a whole bunch of other barriers that are kind of holding us back. And so we're doing the best we can to be at those tables, to be those voices. I really do think of folks who are in power, and whether those are white women, white men, middle age, they are the ones who I think are responsible. Whether they will take up that responsibility and to what degree they will do that, I think depends on that person's progressiveness, which is why I also then again go back to thinking that this needs to be mandated, because if it is required, then they will comply.
Absolutely. I think we were speaking about this a couple of weeks ago. I had folks that work in literature, and well agree that obviously it's not up to the person who's being oppressed, or it's
Right.
up to the oppressor to really unpack and take action and drive effective action when it comes to oppressive systems, and making a change, or rather any effective change. Sorry, Charles, you want to say something?
Yeah, I was going to say that it really comes down to will. And oftentimes when we hear will, we think of political will, the will of governments and all of that. But I think will can also apply beyond the government space to the organizations, the leaders in those organizations, and what are the priorities they set out to do, and to what extent is it, um, uh, because oftentimes inequities exist, lack of representation exists because things have been done the way they've always been done, the status quo. So, for example, hiring, um, you know, posting jobs in different hiring boards or that have always been used, and then realizing that, or if first those hiring boards there isn't a lot of representation there, then even the pool of candidates that apply to your job will not be representative, right? I remember watching an interview with Jon Stewart, I forgot the show, Daily Show, and he said for him the moment of reckoning from him was when someone called him and asked him and said, "Hey, you don't really have a diverse staff, for your comedy writers." And he's like, "Of course I do. Yes, I mean they're all men, but this guy is the one who can really land the punchline. This one is the one who's really good at setting things up, and this one can really come up with those one-liners that really fit and make the script great." But then the person told him, "Well, look again." So he was thinking of diversity as diversity of skills, right? And not so much the gender or the ethnic diversity in his staff. And so what he did was the folks who he would typically reach out to get some comedy talent from. He said, "No, send us all your resumes," but and then they send it. He's like, "But actually, send us the one for the women comedy writers, or the Black women comedy writers." And so he had the will to recognize that the way things have been done before had always led to a particular result, which was him having a generally male white staff. But it wasn't until he specified intentionally to reach out to women writers, Black women writers, that he then began to see the progress. So in that same way, the leaders in these organizations, they have to be proactive in realizing that you gotta do things you gotta do things differently than the way you've always done, because normal goes on to make those inequities and lack of representations to prevail and reproduce over time. So you have people who are saying, "Oh, but we're doing things. We're reaching out to different people, but not really setting the intention towards the people that they're reaching out to, and the people making sure that they are from the communities that are being underrepresented."
Yeah, those that you're absolutely right. You touched on some of the points that I'd raised sometime last week, and I believe I did an article last week on bias aware leadership, and I explored the fact that organizations should not necessarily be seeking candidates to address a fit model. For the most part, I think most people are always looking for the right fit. People need to start challenging that and understand that, when you're looking for a candidate, what are they really addressing when it comes to the client or the customer in this case? Are they actually addressing the client needs strategically? Are they addressing your client's needs? And companies should actually take some time to understand exactly if they reflect those people they serve, whether you're in a public setting or a private setting. And if and understanding how that is enhancing or not enhancing your understanding of that reflection of that community or that client base or that customer base. Is it helping or is it hurting your understanding of the Black community in this case? Is it helping or hurting your understanding of the client? And you remember, the reflection of your client is very diverse, or your customer base is very diverse.
Mhm.
So I think people should start really thinking about those things, as opposed to, okay, do they really fit the team here? Because honestly, I mean, when you walk into a team, I'm not necessarily looking at a situation where the manager looks like the people that report to them, right?
Mm.
It should be a group of very different, diverse backgrounds and perspectives.
Mhm.
And once you get into a situation where everyone really thinks like you or looks like you, then it's a slippery slope, and you're not going to be addressing client needs to begin with. Let me
Mm.
jump on to the other question, because I know the time here is slipping by so fast.
Oh, wow.
So when you look at, I mean, a recent Toronto Public Health report revealed that 83% of COVID cases occurred in racialized people. Black people represented, I believe up to date is about 23% in Toronto, whereas only representing 9% of the entire city's population. So highly, or rather overly represented when it comes to the number of cases of COVID. What are your thoughts on this disproportionate representation of Blacks, especially when it comes to, this is more or less healthcare? I'll take this back to Felicia.
Um, when it comes to look at the statistics, I'm not surprised.
Me
I would
too.
actually be surprised if
Not at all.
we were on par or doing better than non-Black folks. And I mean, like working in healthcare, we see that we have poor outcomes across multiple different disease areas. So this is just nothing new. This is just another result of systemic racism. I think the important thing here is that with COVID-19, there's been more conversations about how folks are disproportionately affected and also talking about race-based data collection. I think it's important to continue that conversation going forward and to continue to advocate for race-based data collection so that we can use that to substantiate programming and policy to improve outcomes.
A lot of organizational settings have always steered clear of collecting race-based data, where they seem to think that that advocates for equity, or rather equality in this case. Um, and and I think that that has been a contentious piece, especially when it comes to Blacks and other marginalized communities, where the data is not there, and people are always screaming, okay, show me the data, show me the data. And now, do you believe that this arms a lot of, to Charles' point, willful, intentional, honest pursuit of equity practices when as it pertains to Blacks and other marginalized communities? Data like this.
Yeah, so we're seeing that governments still haven't pursued that will to standardize race-based data collection outside of the pandemic. And so I think it's really important for us to continue that conversation and advocating for race-based data collection, but we have to make sure we take it a step further than the US. So the US, they have extensive data on race outcomes, but they have nothing mandating that they will actually use that data to address disparities. They just collect the data. And so I think we need to take it a step further and say that folks who are affected by this data collection, so members of marginalized communities, need to be involved in all phases. It's collection, analysis, to dissemination. And we also need to make sure that there's also a commitment to not only just collect the data, but also to act on the data if there are disparities.
Yeah, I think at least in companies or rather organization settings that I've worked for, most people have, or rather most organization settings have always stayed clear of collecting race-based data, with the feeling that that enhances issues that don't really need to be unpacked, and they dismiss it as, okay, if anything, you're actually creating racism as opposed to actually fixing racism. But you can't fix what you don't really know.
Right.
And if you're telling me that I don't have the data, then I should be able to start collecting it. And to your point again, Felicia, I think it's very important. Yes, I mean, we just don't want to be in a situation like the States, where you collect a large amount of data and then there's nothing being done with it. There's no accountability towards moving that into action. as opposed to, and actually to go back to this point, I believe Statistics Canada now is pursuing collection of race-based data, and they've put out a report on but obviously it's not as in-depth as it should be, obviously, because they've not been collecting it. And most of the data that I've seen in Canada, especially, has been from education institutions like the Ryersons, the York University research that they have on race and so forth. But I definitely would want to see this on a large scale. Charles, your thoughts?
Yeah, I completely agree. When I saw that question, I was like, of course, it's not surprising. I was talking to some of my folks in the public health field, and like, yeah, well, of course not. I mean, simple. Even look at the broad spectrum of health problems. I know, Felicia, you work with cancer. I'm sure if you looked at cancer, it's the same. The same with diabetes. The same with chronic heart disease. So why should COVID be uh, any different? Well, I tell you why it shouldn't be different, because um, the society as we live in it is already unequal. There's social inequities that exist. So you're overlapping the health conditions, the illnesses on these social inequities. Well, it's like when you make a mold, you put water in an ice mold, or what does it do? It takes the shape of the mold. So you, if you put diabetes, put cancer, put COVID over the social inequities that exist, then it's going to take those molds. So it shouldn't be surprising. And the other thing as well is, you know, with COVID now, it's not just, I actually had COVID back in April, and I got it from my mom. And the other question is, where Black folks live and where we work. A lot of Black folks, especially within the city of Toronto, we live in segregated neighborhoods that tend to be high rises, and of course, when you're using the elevator, which is an enclosed space, or walking through a long hallway, the likelihood of those air droplets that carry the virus to be spread and to remain in that air is higher versus someone who has their house by the beaches. And actually, the city of Toronto released the data looking at the number of COVID cases around the city, and I believe sometime in August or in July, there were very low cases in the beaches neighborhood compared to the northwest of the city, where there was 100 or 200 of that. That's inequity right there. And so we need to look at that. Also, our folks tend to work in roles like PSWs or nurses or RPNs, and not just that, but also other jobs that are front facing. So of course they're going to be in contact more with the general population, and which goes on to put us at risk of getting COVID or developing any other health condition. So it's not surprising, as the moment we realize that there's all these social inequities that exist, and the health conditions generally tend to mirror those health inequities, then it should motivate us to start, putting the will and intention and the policy to reduce those health inequities, to reduce those social inequities, like racism, income inequality, poor neighborhoods, lack of housing that's safe, secure, and affordable and stable. Once you target those social determinants of health, then every other condition downstream just follows that.
Absolutely. You just nailed on the head. You hit the nail on the head. Social, economic, political factors all leads to the health and well-being of human beings. And the more equitable those factors are, then the better the outcomes, the better the health and well-being of human beings. And those are fairly full of inequities, especially when you look at our system. And obviously, we're going to find high dense concentration of more Blacks living in dense locations as opposed to others or other white colleagues. And so, yeah, the data is not surprising. However, I must underscore that I think when we say it's not surprising, it can lead to a situation where it's highly desensitized. And when we normalize these situations, people are almost not quick to take action because they think it's the norm. And so I think it's important that, within our spaces that we're always highlighting that, these are not the norm and we should do something about it and drive into action. So finally, what role do you think healthcare plays in addressing systemic racism? I think we've discussed some of it, but I'll just take it back for your thoughts, Polish, and then I'll get yours, Charles.
Um, I think healthcare can play a role where they can, depending on where you are, whether it means advocating to governments for more funding to address upstream factors, whether it means making sure that they are delivering programs that are tailored and targeted with culturally relevant language. But I think that it's not just healthcare who has responsibility to address this. I think it's really important to not dismiss other areas, whether it's even finance, human resources. I think that we need to have multi-sectoral support to address that.
Absolutely. I agree. Not the reason why I asked that question is because I asked that on every episode. So when we're talking about tech, I say, okay, how do you think tech fixes healthcare? Systemic racism and so forth. And I know there's a space for everyone in this case. Charles, your thoughts?
Yes, I gotta say, I'm getting a lot of similar vibes from Felicia here, and which is great because I think we need more folks to realize that healthcare doesn't just start or involve going to the hospital or going to see a doctor or like me, going for a run every other day or going cycling. Because a lot of folks think healthcare is like, well, you got to take care of your health and you got to do all of these things. But I came across this thing called health in all policies. It's a framework of looking at general public policies from a health lens. So you think of immigration, for example. Now, well, where's the health in immigration? Well, guess what? A lot of a lot of immigrants to Canada, especially those from the African continent, the African diaspora, Caribbean, for example, they come here and they're told, oh, you don't really have the Canadian experience, and so you can't really work in an equivalent role in this country, Canada. And talk about systemic racism. That's it, because they all our policies are that you got to have so and so accreditation, but these are highly qualified professionals, even more so qualified than some of the homeborn Canadians. Well, what happens when you tell them that? Well, they have to take a gig, maybe in a factory or elsewhere that's unrelated to the skills that they can bring. And what happens is, especially for those who see themselves as a primary economic provider for their family, which tends to be men, that's the research that I do. When they're not able to fulfill that role, it starts to erode their health, their mental health. They start to get really stressed, and they start to really question, they start to really question if they even made the right decision having to come to Canada. And over time, the reason why inequities exist in health is that it's not just one thing, it's a whole lot of things. And, it's death by multiple wounds. So over time, you develop a chronic stress, and it shows up as diabetes, shows up as cardiovascular disease, shows up as a whole lot of other things. So this started out as a policy that's ostensibly about just immigration, right? And even for the Canadian government, Canadian population, when you give people the promise of coming here based on their skills, I heard the other day that the government is increasing immigration by doubling it. So I think from around 200,000 to 400,000 now. Well, what happens is that when you have folks who come here from the economic class migrants and they cannot contribute their skills, it's not just the immigrants who lose out, it's the Canadian workforce, it's the government, it's their colleagues at work, because we live in a very globalized world now, which means multiple viewpoints can really lead to innovation. Going back to the point that you said before, Kevin, instead of having people who think a particular way and having, existing in this bubble, you can inject some diversity into that. But then when you have immigrants come over here and their skills are not being utilized, it really, that Canada cannot compete on a global stage, and maybe if Justin Trudeau is watching this, he can take into that. We can't really compete on a global stage. So, it's the entire country that's losing out on these things. But back to the immigrant, yeah. So even though it's ostensibly about immigration, there's health tied in there, and so once you start to make these connections, then we can really see that healthcare has a role to play, not just in reducing systemic racism when it comes to the health field, but in all fields, really.
I agree. I mean, the health and well-being of any individual, whether you're Black or white or part of the indigenous community, and all other marginalized communities in this case, your health and well-being really determines exactly how you can maximize your potential as an individual. And if I'm not healthy, and if I'm not taking care of my well-being, or if that's compromised because of a system that does not necessarily address to my equitable needs, then I cannot maximize my potential, period. COVID is a good example. You can take a look and see exactly how it's devastating marginalized community right across the world, right? And I believe, to your point again, Charles, you mentioned a really good point where, immigrants come over, whatever immigrants are moving to right across the world, there's a huge untapped talent. I believe it was done by the World Economic Forum, huge study where we have a ton of people who've migrated right across the world, and they cannot really maximize their potential because of policy and practice within these countries they've moved to. And this is a great example, where, for example, a physician moves to Canada, they're told they don't have the Canadian experience, they got to spend a certain amount of time, qualifying for the Canadian, yeah, for the Canadian, for a Canadian qualification or experience or whatever the case is. And if you go right across the world, there's a huge untapped talent that's just dying. It's just slowly dying because of poor policy and practice. So those are some great points. Again, I think healthcare does address systemic racism in a very unique way. And I think self-care is very important. Mental well-being is very important. Physical fitness, whatever the case is, your health and well-being, second to none when it comes to you actually maximizing your potential within any society, right? And whether that's pursuing your dreams, accessing wealth, breaking barriers, whatever the case is, it's pivotal, and it's vital in any society. So I'll just take this down to closing thoughts. I know we're 6 minutes past our time. I'll let Policia go, and then your closing thoughts, Policia, and then we'll go to Charles, and then I'll put in my 2 cents, and then we'll call it a day. Thanks again. So Policia, your thoughts?
Yeah, so I think that it's going to take a multidisciplinary approach in terms of reducing barriers for Black communities, in terms of getting both into healthcare and also improving our health outcomes. I think it's going to take a lot of collaboration, but I think it's really important to recognize that those with power are the ones who may potentially have the most ability to make change, and I challenge those in positions of power to do so.
Thank you. I agree. Charles, your thoughts? Closing thoughts?
So two things. One is the role of healthcare leaders, and recognizing that you've got the onus really lies on you to take the initiative to look at your organizations, even just healthcare leaders, but leaders in general, especially those who are in elected offices. Look at your organization, look at your municipalities, your cities, look at the policies that you have there and the practices and all the procedures, and bring in someone, a Black person, from a racialized community, and have them look over it and see what ways are these policies and practices discriminatory to Black folks and racialized folks. Because the thing with systemic racism is that it's not visible. It's not visible until it is visible. So there was a story of the indigenous woman who live streamed her own death and how neglected she was. She was neglected by nurses who were supposed to be the people taking care of our health. So I didn't know what the situation was in that hospital, but imagine how many more people who have died or whose health has been undermined because of that kind of treatment. So that's one. The other one is the reason why we're even having this conversation to begin with is as a result of so many years of advocacy and pushing and discontent and not being okay with just a run-of-the-mill policies that have been made. And so advocacy is important. We are going to have to advocate for ourselves, and we've been doing that. So I want to give a shout out to organizations like the Black Health Alliance that really advocates for the health of Black communities, and even organization like NIA Center for the Arts. So it's an arts center that's an arts organization that's just focused on the showcasing the work of Black artists who tend to be underrepresented in the arts and culture sectors. And they were part of folks who compelled the prime minister to bring in there's a multi-million-dollar grant now just for Black artists and Black professionals. So it takes advocacy, and so we all in this together, and we really got to support the work of all these organizations that advocate for us, but also in our own workplaces and in our own families, keeping this conversation alive.
Thank you. Thanks for sharing that. I absolutely agree. And I hope you guys are having those conversations with your own workspaces. I can take from your passion in this topic. You must be engaging within your workspaces, and navigating through those, and that's really appreciated. And if you know anyone that's really struggling to get into this space, rather struggling with this topic, which I know can be very difficult, especially for white colleagues, feel free to reach out to any one of any the D&I consultants out there, including myself and many others in this space. We'll be more than happy to, take this on head on and create that awareness and break the ice and make sure that people can understand that, this is a necessary conversation, and we're not going to see change if we don't talk about the big elephant in the room. Again, thanks for joining us for a 7th episode on this series. So we create a safe space for Black professionals. We talk about different industries, and I'm hoping that obviously our viewers out there can take some time to reflect, understand, and at least can resonate with some of the topics that we discuss on this channel, and drive them to action to begin with. Once again, thanks, Felicia, for joining us. I appreciate your insights and thoughts and perspectives on this. Same thing, Charles. Great thoughts and perspectives as well. And certainly hope we can keep this conversation going and the network's going as well. Make sure we can reach out to one another whenever we can, and just chat. Okay. Again, appreciate you joining us, and up until next time, I will have to call this an end for now. Thanks again.
Bye, everyone.
Thank you.
Bye now.